A very good evening and welcome to The Bottom Line, a wrap of some of your top business news stories of the day. My name is Nzinga Kunda and we begin as usual with your number of the day. Today that number is 259 billion rand. That's the amount that former Health Minister Dr. Motsaledi estimated it would cost to implement national health insurance. The South African government is implementing national health insurance, a financing system that will make sure that all citizens of South Africa, according to them, as well as legal long-term residents, are provided with essential health care, regardless of their employment status and ability to make a direct monetary contribution to the NHI fund. Now, according to the white paper on the NHI, South Africa spends almost 8.6% of gross domestic product on healthcare. So 4.1% of health expenditure as a percentage of GDP is spent on 84% of the uninsured population, while 4.4% is spent on the 16% of the population covered by private medical schemes and who in the main access their healthcare services in the private sector. So there has been unease from many quarters over the NHI, in part because of the lack of clarity as to the cost of implementation, a worry about the standard of healthcare, and a lack of choice. So that's the last reported number, 259 billion rand. So Dr. Zweli Mkhize, our Health Minister, joins me in studio now. Thanks so much for your time on SABC News this evening, Minister. Talk to us about the cost of implementation. We know that that figure is quite an old one, and that is also an estimate. How much will NHI cost to implement?
Well, the figure you have, 259 billion, it comes from an estimation that was made way back around 2010. Right now, the cost of healthcare, both in public and private, is just around 460 billion. And then the estimation that the Treasury has worked on, taking a number of factors into account, is just below, it's around 400 billion, a bit below that. And it is actually indicating that by 2026, on the current funding trajectory, they'll have to raise an additional 30 billion rand. So there's been quite a lot of revision. And what makes the revision is that you have to keep looking at the package of services that will be offered, and you'll also have to look at the growth rate, the GDP growth and so on. So it's always going to be a figure that you can't be tight and certain about it until at the time when you say, okay, now everything is ready, we start the process of implementation, and that should be, for us, we'll have a figure much firmly around 2025, 2026.
Okay. Let's talk about the first phase of implementation of the NHI that's taken place. It was meant to strengthen health systems in 11 NHI pilot districts. Talk to us about what happened there and the second phase.
Well, the first phase was more about looking at what needs to be done to create a foundation for national health insurance. It's actually given us very good information, and we're very happy about what we have actually learned out of it. So, for example, it was able to show that we need ward-based outreach teams, and that's actually something that's doing very well. It gave us what needs to be strengthened, and at that level, it has actually instituted what we call CCMDD, which is a medicine for 2.3 million people to get access to medicine without having to get to the hospital and stand in a queue. That number has actually been improved now to about 4 million people who are in that kind of system. It also helped us to pick up a system which we call stock visibility system, wherein we're to enlist or 300 clinics so that they can actually check the movement of stock from manufacturing right up to the clinic, and that's also been very, very encouraging. Then we looked at the ideal clinics kind of assessment. At that time, they actually had about 1,500. The number has gone up to about the 3,000 of those clinics. So there's been lots of good lessons. It's also showed us some challenges on infrastructure, and then some models which are more expensive. For example, the district specialist model is seen to be very expensive, so we need to revise that. So I would say that there's been a very good lesson out of that. The next phase is going to be involving a couple of issues. One of those is that we've got the bill in Parliament that needs to be processed to create a legal framework for the national health insurance. And linked to that is going to be about upgrading various shortfalls within the health departments, issues of staffing, infrastructure, issues of supply of medicine, and ensuring that the quality of healthcare is improved. So that we're going to be working on for the next up to 2025, 2026. So we believe that there's quite a lot of work to be done.
Okay, so those challenges that you've mentioned, the health department says that in public health spaces they include a lack of planning, a lack of governance, and a lack of medication in key health professionals. I know you've just given me time frames. My question is, there's a lot of anxiety. We've just seen in Tembisa 10 babies passing away due to that virus and what seems to be a lack of hygiene and lack of staff there. Why should South Africans and people who will be accessing NHI trust that their health, their lives will be safe when we see stories like that continually? I
think we must always put everything in context. The biggest challenge in Gauteng is the high rate of migration. So all the hospitals in Gauteng are overrun because of the many people that come in that were unplanned for, and therefore they could be local, they could be coming from different provinces, they could be coming from other countries. So that creates a huge amount of pressure in the hospital, so that when the hospital would have been useful at a particular point, then with a sprawling new informal settlements, the population rises without adequate notice to be able to revise the staff establishment. And of course the resource constraints will give you those kinds of challenges. What happened in the case of Tembisa is that is a spread of what we call nosocomial infection, what we talk about as the resistance, where one bacteria becomes resistant to particular antibiotic, and as a result it then spreads over to infect people, and it becomes very difficult to treat. It's a problem all over the world. The world is actually going through a problem of antimicrobial resistance. It's big in Europe, it's big in many countries. So it's something that we have to work very hard on. That needs its own programs. This last year there was a huge campaign, a huge conference in Holland, in Netherlands, to discuss this issue. It's a world phenomenon. On the other side, we've also got to re-look at our staffing so that we improve the norms, and also look at improving the facilities, because you've got a neonatal unit that might have had maybe 15 beds, and all of a sudden you find that it's got 20, 30 patients in there. That's because of the pressure. So it's something that we have to struggle through, but it's very regrettable. But at the end of the day, it's something that we understand we have to work on until it can be resolved.
Let's go to the financing, which is also one of the challenges. There's sometimes a lack of clarity there. My understanding was at some point there's going to be a model where people who earned around 70,000 Rand were going to be taxed. What's the latest there, and how is that NHI going to be funded?
You're quite right. The concern that many people have is that they fear what the NHI is going to be all about. Sometimes because of lack of information, it becomes an issue, but sometimes because there are those who have got interest who would then spread a lot more of fear-mongering. So it becomes a very difficult issue to try and deal with. However, I think it's important to say that some of the issues that have been raised are issues that we have to deal with. Firstly, the question of how much it will cost. You will not be able to give a finite figure, because you have to look at the revising of the package and the growth rate and all of that. So we have said that we'll implement this incrementally in a way that will actually be afforded by the fiscus. So we will not have a situation where we bankrupt the country. We have a situation where we're going to keep incrementally taking the packages up so that we are able to deal with it. Secondly, the definite cost of it is going to be, we say broadly, money must come from the fiscus, it must also come from contributions from employers, employees, and it must also come from surcharges. That's the broad principle of it. When you want to know the details and the specifics, you need a money bill, which will come from the Minister of Finance, and they are nowhere near being able to do that. That's when all those figures, consideration as to tax burden, the numbers of people who are doing tax, and so on, that's when it will come up. Right now, I think it's important to say we're dealing with the principle of the bill, and that the money bill is the one that will be able to deal with the issue at that level. Okay. There are quite a number of people who keep raising the question the country can't afford it. The reality is that we've allowed so much inequity that we feel it's normal to have an inequitous access to healthcare. We need to correct it, and part of correcting it is to actually understand that you can't put too much of a price on saving the lives of South Africans.
Okay. There are affected stakeholders. I know you've touched on the issue of some people who you feel have interest in, who are trying to fearmonger. There are affected stakeholders such as the South African Police Service, provincial treasuries, private hospitals, who are against the NHI, who you've consulted with. Talk to us about how you engage people like that who are very important to that bill, to the NHI, my apologies, and try and get them to accept that this may happen, this will happen, and get them on your side?
Well, I'm actually surprised about the SAPS because those are civil servants, and the structure and the policy of the medical aid that is available to them is something that gets negotiated with government, and government is putting a lot of subsidy onto that particular medical scheme. So I've not really come across the issue directly to be able to discuss it. Nevertheless, it's not for now that matter must be discussed. It must be later when we have instituted NHI that will start looking at what changes, what adjustments are needed on the medical aids. When it comes to the provincial treasuries, I think somebody spoke out of 10 there, because we're discussing these issues as government, as various departments, both national and provincial treasuries, as well as Department of Health. If there are issues that would have arisen there, I'm not aware that there's a provincial treasury that could raise issues. After all, provincial treasuries don't have their own sources of income. They actually receive money from the fiscus at national level based on the policy of national government and based on what is called Division of Revenue Act, and that is something that gets negotiated at a political level with intergovernmental forums to be able to discuss all of those issues. Financial and Fiscal Commission also looks at all those issues. So I wouldn't have expected that provincial treasury could be raising an issue independent of the entire system. The private hospitals, well, there I think we need a good conversation. We've just had a release of the health market inquiry, which was headed by Judge Ngobo. They've actually criticized the private hospitals for anti-competitive behavior, and I think that's where we should start the discussion.
Dr. Zweli Mkhize, Minister of Health, joining me in studio. Thanks so much for your time on SABC News this evening. Trade Union AMCU